Welcome to AI DocuFeed, where we break down complex documents into easy-to-understand podcasts. Today, we're tackling the official Medicare and U 2025 handbook. Be sure to check the show notes for links to FAQs and worksheets you can use to follow along or fill out after the show. Please note, this podcast is for informational purposes only and does not provide financial, medical, or tax advice. Always consult a qualified professional for your specific needs.
Ever miss a deadline? Like forgetting to book a flight and your friends are off having fun without you? Well, that's how we want to help you avoid feeling when it comes to Medicare enrollment.
Missing those Medicare deadlines can really cost you way more than missing a vacation. We're talking about gaps in coverage and even penalties that could last a lifetime. So this deep dive, we're focusing on you, our listeners, who are turning 65 and figuring out this whole Medicare enrollment thing.
Exactly. We're going to break down the three main enrollment periods. That's your initial enrollment period, open enrollment, and then those special enrollment periods that can come up because of big life changes.
All right, so let's jump right in with that initial enrollment period, or the IEP. This is your first chance to sign up for Medicare, and it all revolves around your 65th birthday.
Okay, so it's all about your 65th birthday. So how long do you actually have?
You got a 7-month window to enroll. It opens up 3 months before the month you were born, includes your birth month, and then goes for 3 months after. So let's say you were born on June 2nd.
All right, June 2nd, got it.
Your IEP would start in March and run all the way to September.
Okay, so you got a good chunk of time. Is there any benefit to signing up early?
Absolutely. Enrolling early in that window can be really strategic. Your coverage will typically start right on the first day of your birth month, so you won't have a gap in coverage right from the start.
Okay, so no gap in coverage.
If you wait, it could push back your start date.
Okay, so let's say, you miss that window. What happens?
Well, if you miss your IEP, you could end up facing those penalties we talked about earlier. But don't worry, you've got another chance to enroll or tweak your plan every year, and that's called the open enrollment period.
All right, so the open enrollment period, that's kind of like your annual Medicare checkup, right?
Exactly. It runs from October 15th to December 7th every year. So it's your chance to switch plans, maybe find a better deal, or make sure your coverage still fits what you need.
Okay, and sometimes, life throws you a curveball, and you might need to make changes to your Medicare plan outside of those regular enrollment periods, right?
Yeah, of course. That's where special enrollment periods come in, or SEPs. Those are triggered by specific things happening in your life.
Okay, what kind of life events are we talking about?
Well, things like losing your job-based health coverage, moving to a different state, or maybe becoming eligible for Medicaid.
So like big changes.
Yeah, big changes. And those allow you to enroll in Medicare even if it's not during those usual times.
Okay, so those SEPs definitely offer some flexibility if your situation changes unexpectedly. But let's go back to those penalties for a minute, because I think that's a big concern for a lot of people. What are the consequences if you miss those initial deadlines?
Well, if you delay signing up for Part A and or Part B, you could get hit with permanent late enrollment penalties, which can be pretty hefty.
Hefty. Okay, can you give us an idea of what that might look like?
Sure. For Part A, if you delay, your monthly premium could go up by 10% for twice the number of years you were eligible but didn't sign up. So let's say you were eligible for 2 years but didn't enroll. You'd face that 10% penalty for a total of 4 years.
Wow. Yeah, those penalties can add up. And Part B has penalties too, right?
Yeah, Part B does.
Yeah.
The penalty is a 10% increase for every full 12 months you could have had Part B but chose not to enroll. It's really important to grasp those penalties and just enroll on time to avoid them.
It sounds like we could all use some help navigating this whole thing. Are there resources available to help us stay on track and, make good decisions about our Medicare coverage?
There are some great tools out there. Medicare.gov is a fantastic website.
All right, so Medicare.gov, one-stop shop for Medicare.
Exactly, and they have this great tool called the Medicare Plan Finder. It lets you compare different plans side by side, see costs, coverage details, and even check out star ratings based on what other folks have experienced.
And I've heard about a program that offers more personalized help, which can be really helpful when you're dealing with something as important as healthcare. What about the State Health Insurance Assistance Program?
Yeah, you're thinking of SHIP. They have trained counselors who give free and impartial advice. They can help you understand Medicare, compare plans, and even help you with the enrollment paperwork.
So it's like local experts who can walk you through it step by step.
Don't hesitate to reach out to them. They're an amazing resource.
These resources sound incredibly helpful, especially for those of us who are new to the Medicare world. It's reassuring to know that there's help available to make this process less, overwhelming.
Absolutely. We want you to feel confident and in control as you navigate Medicare enrollment. These resources are here to guide you and answer any questions.
Well, we've covered a lot of ground, but really we've just scratched the surface of Medicare. In the next part of our deep dive, we'll explore the financial side of things. We're going to break down Part A, Part B, Part D, all those costs so you can start planning your healthcare budget. So stay tuned.
Medicare enrollment can feel like navigating a maze. Timing is everything, and missing a deadline could mean penalties or delays in coverage. But don't stress. That's why we're here. If this feels like a lot to take in, remember we've got tools to help. Check the show notes for a downloadable FAQ sheet and a worksheet designed to keep you on track. Use them to jot down key dates, take notes, and even map out your next steps. Let's make Medicare work for you.
Welcome back to our deep dive into Medicare. So now that we've got a handle on the enrollment periods and deadlines, let's get into the money part. Figuring out the costs associated with Medicare is so important for planning that healthcare budget.
Absolutely, it's key. We're going to break down the different parts of Medicare and what they actually cover, starting with the two main players, Part A and Part B.
All right, so Part A, where do we begin? What does it cover? And, what are the usual costs?
So Part A covers inpatient hospital care. Think of it as your safety net for those big medical events. Hospital stays, skilled nursing facility care if you need it after a hospital stay, some home health care, and hospice care.
So it's there for the major stuff. What about the cost?
Well, here's the good news. Most people don't actually pay a monthly premium for Part A. If you or your spouse worked and paid Medicare taxes for at least 10 years, you typically qualify for premium-free Part A.
Okay, so that's a relief. But what if you don't meet that 10-year work requirement?
You can buy Part A, but it will come with a monthly premium. The cost can change depending on how long you or your spouse worked and paid those Medicare taxes.
Okay, got it. So Part A is either free or you pay a premium based on work history. What about Part B? What does it cover, and are there costs associated with that?
Part B covers outpatient services, so think doctor visits, preventive care, medical equipment, and some home health care. It's for those checkups and any ongoing medical needs you have.
So routine stuff.
Exactly, the things you need regularly.
Okay, what about the costs for Part B?
Unlike Part A, everyone who has Part B pays a monthly premium for it. It's usually taken out of your Social Security benefits, or they'll just bill you directly.
Okay, is the Part B premium the same for everyone?
The standard Part B premium is the same for most folks. However, it can be higher if your income is above a certain level.
Okay, so higher income could mean a higher Part B premium. And we've got to remember to enroll in Part B during that initial enrollment period to avoid those penalties.
Exactly. Missing that initial enrollment window for Part B can lead to a higher premium, and that increase is permanent. Okay, so now let's shift gears and talk about Part D, which is all about those prescription drugs.
Part D, that always sounds a little more complicated to me. Can you break it down? How does it work?
Part D is actually provided through private insurance companies that work with Medicare. You pick a plan that fits your medication needs best.
So it's not directly through Medicare, like Part A and Part B. Okay, that does sound a bit trickier.
It can be. There are a lot of different Part D plans out there, each with its own list of covered drugs. It's called a formulary, and each with its own costs.
So how do you even know which plan to choose? There are so many options. I mean, it sounds overwhelming.
Remember that Medicare Plan Finder tool we talked about? It can be really helpful for this. You put in your medications, and it compares different plans side by side, showing you the estimated costs for each one.
So that helps you sort through it all and make a good choice. And what about those counselors? Can they help with Part D too?
Absolutely. They can walk you through the different plans, compare costs, help you find one that covers your meds and fits your budget.
It's like having your own personal Medicare advisor.
Okay, so we've talked about Part A, Part B, Part D. Now, I know there are also Medicare Advantage plans, sometimes called Part C. Where do those fit in?
Okay, so Medicare Advantage plans are kind of like an alternative to original Medicare, which includes Part A and Part B. They're offered by private insurance companies that are approved by Medicare. They have to cover at least the same benefits as original Medicare, but they often have some extra perks.
Vision, dental, and hearing coverage are pretty common. And they might also have things like fitness programs or other wellness benefits. But there are some trade-offs to consider. Medicare Advantage plans usually have a network of providers that you need to stick to in order to get the full benefits. So you might need to switch doctors or specialists if they're not in that plan's network.
So you're trading a broader range of benefits with potentially fewer choices when it comes to providers.
Yeah, that's the trade-off. You really have to weigh the pros and cons. Think about your specific health needs and check if your preferred doctors are even in the plan's network.
And how do the costs compare between original Medicare and Medicare Advantage?
It really depends on the specific plan. Medicare Advantage plans usually have monthly premiums, but those could actually be lower than that Part B premium you'd pay with original Medicare. But keep in mind, you might have copays, coinsurance, or deductibles for the services you use.
So there are different things to consider with each option in terms of cost. What resources are out there to help folks compare Medicare Advantage plans and choose the right one for them?
That Medicare Plan Finder tool we talked about is still a great resource. You can use it to compare Medicare Advantage plans against original Medicare and Part D plans. It takes your needs, your preferences, and your budget into account, making it easier to make a good decision.
And those counselors can help with this part too, right?
Of course, they can provide guidance and help you navigate the decision between original Medicare and Medicare Advantage, considering your healthcare needs and your budget.
All right, so we've covered the basics of Part A, Part B, Part D, and Medicare Advantage. Now let's move on to another really important aspect of Medicare: the programs and resources that can help people manage those healthcare costs. Stay tuned for the final part of our deep dive.
If you've made it this far, chances are you're finding this helpful. Why not share the clarity? Subscribe to the podcast and share it with someone who might need a little Medicare guidance. Let's help more people navigate this together.
Welcome back to the deep dive. We've talked about enrollment periods, deadlines, and the costs of different parts of Medicare. Now let's dive into what Medicare actually covers, and just as importantly, what it doesn't.
Yeah, knowing what's covered and what's not can save you a lot of headaches and help you make better decisions about your health care. So let's start by unpacking the services that Medicare typically covers.
Sounds good. So what are some of the key services that Medicare beneficiaries can expect to have covered?
Well, Medicare covers a wide range of services. Hospital care is a big one. That includes inpatient services like your room and board, nursing care, medications, tests you might need during a hospital stay.
That's good to know. Knowing you're covered for those unexpected hospital visits definitely gives you peace of mind. What about doctor's visits? Are those covered under Medicare too?
Absolutely. Medicare covers a variety of doctor's services, office visits, preventative care like screenings and immunizations, even some mental health services.
Okay, so regular checkups, vaccinations, mental health care. It sounds like a pretty good range of services. What other areas does Medicare cover?
Medicare also covers skilled nursing facility care if you need it after a hospital stay. This is for folks who need a bit more care than they can get at home.
And what about people who need ongoing care in their homes? Does Medicare cover home health services?
It does. Medicare covers a certain amount of home health care if you meet certain requirements. That could include things like skilled nursing care, physical therapy, or even speech therapy, all in the comfort of your home.
Okay, so it sounds like Medicare can help with those essential healthcare needs both inside and outside of a hospital setting. That's really reassuring. Now, we know prescription drugs are covered under Part D, but are all medications covered?
That's a really important point. Medicare Part D doesn't cover every single medication. Each Part D plan has its own list of covered drugs, and that's called a formulary. It's really important to look closely at the formulary of any plan you're considering to make sure that it includes the medications you need.
Okay, so it's not a blanket coverage for all medications? It sounds like Medicare covers a lot of those essential healthcare services, but I think it's equally important to understand what Medicare doesn't cover, those gaps in coverage.
You're absolutely right. There are some gaps that can catch people off guard.
Right, so let's talk about those gaps. What are some services that people might be surprised to learn Medicare doesn't cover?
One of the biggest ones is that Medicare doesn't cover long-term care. So things like extended stays in nursing homes or assisted living facilities, that's not covered.
That is surprising. A lot of people probably assume Medicare would cover those services. How do people typically pay for long-term care if they need it?
That's a great question, and it's something everyone should be thinking about as they get older. Long-term care can be really expensive, and traditional health insurance usually doesn't cover it.
So people might need to explore things like long-term care insurance or rely on personal savings to handle those costs. What are some other services that are commonly excluded from Medicare coverage?
Another big one is dental care. Medicare typically doesn't cover routine dental exams, cleanings, fillings, or dentures.
Yeah, that can add up. Are there any exceptions to that?
There are limited exceptions if the dental care is considered medically necessary. Like, let's say you need a dental procedure that's part of a covered medical treatment, then it might be covered. But your typical routine dental care is usually not covered under Medicare.
Okay, so dental's generally out. What about vision care? Are eye exams and glasses covered?
Routine eye exams and glasses are usually not covered by Medicare either. But Medicare might cover some eye care services if you have certain eye conditions like cataracts or glaucoma.
So there's a difference between routine vision care and care that's needed for a specific medical eye condition.
Exactly. It's always a good idea to check with Medicare or your plan directly to see what's covered and what's not in your specific case.
Yeah, it never hurts to ask. What about hearing aids? Are those covered?
Hearing aids are another big expense that Medicare usually doesn't cover. And that can be a big financial strain for people who need help with their hearing.
So it seems like Medicare has some significant gaps, particularly when it comes to things like dental, vision, and hearing.
You're right, and it's important to know about these gaps and plan accordingly. And keep in mind, we've just touched on some of the more common exclusions. There might be other services that aren't covered. So again, always check with Medicare or your plan provider just to be sure.
Well, this has been a really eye-opening deep dive into the world of Medicare. We've covered enrollment periods, costs, what's covered and what's not covered, all those essential things.
We've packed a lot into this episode. Hopefully it's given you the knowledge you need to confidently navigate Medicare.
And remember, there are resources out there to help you understand your options and make good decisions about your health care. So don't hesitate to reach out to Medicare, those counselors, or any other trusted sources for guidance.
Healthcare is constantly changing, so staying informed is the best way to make sure you're making the right choices for your health and your well-being.
Thank you so much for joining us on this deep dive into Medicare. We hope you found it informative and empowering. Until next time, stay healthy and stay informed.
Thanks for listening. Don't forget to check the show notes for helpful worksheets and share this episode with someone who needs Medicare clarity. Next time, we'll explore Medicare coverage options, what's included, and how to choose the right plan. See you then.